Have you ever wondered if your penis size is normal? It's probably one of the most common questions men ask themselves at some point in their lives. And interestingly, most men never actually ask a doctor. Instead, they compare themselves to unrealistic things: pornography, locker room myths, exaggerated stories from friends, or random numbers they read online. But here's the problem: most of those numbers are wrong, and that creates unnecessary anxiety for millions of men around the world. So in this video, we are going to answer a very important question. What is the real average penis size? And maybe even more importantly, does it actually matter? Because in my clinical practice as a plastic surgeon specializing in male genital surgery, I see something very interesting. I see men with completely normal penis sizes who believe they are small. And I also see men with very large penis sizes who still want enlargement surgery. Let me give you a real example. We have patients from many different countries. Some patients from Latin America, for example from Cuba, come to consultation with a penis size of 20 centimeters, which is already significantly above average. But they still want enlargement surgery because culturally they feel the penis should be even larger. On the other hand, we also see men with a penis size of 10 centimeters in erection who are perfectly confident, have stable relationships, and are completely satisfied with their sexual life. So what does that tell us? That penis size is not only about anatomy. It is also about perception, expectations, culture, and psychology. But to understand all of this, we first need to understand the science. What is the real average penis size? How much variation exists between men? Are there differences between countries? Do hand size, height, or shoe size actually predict penis size? And most importantly, when is penis size considered normal? And when should someone actually consider medical treatment or surgery? In this video, we are going to explore all of these questions based on scientific data. But before we go deeper into the topic, let me briefly introduce myself. My name is Dr. César Noval. I am a plastic surgeon and director of Clinica NEF, where we specialize in genital surgery, including penile lengthening, girth enhancement, and gender affirmation surgery. Our clinics are currently located in Spain, Mexico, and Miami, and we treat patients from all around the world. This channel is dedicated to male sexual health, medical education, and the science behind male anatomy, helping men understand their bodies and make informed decisions. So if you're interested in topics like erections, penis enlargement, sexual health, and men's confidence, consider subscribing. Now let's go back to the main question. What is the average penis size? One of the most important scientific studies ever conducted on penis size was published in the British Journal of Urology International. Researchers analyzed data from over 15,000 men worldwide, making it the most reliable study we currently have. And the results might surprise you. The average erect penis length is approximately 13.1 centimeters, or about 5.16 inches. The average flaccid length is about 9.1 centimeters, or 3.6 inches. And the average erect circumference, or girth, is around 11.6 centimeters, or 4.6 inches. This means that most men fall within a relatively small range around these averages. In fact, statistically speaking, about 90% of men fall within just a few centimeters of the average. So when someone believes they are extremely small, in many cases they are actually within the normal range. Why do so many men think they are small? This is a fascinating psychological phenomenon, and it happens for several reasons. First, visual perception. Men usually look at their penis from above. But when you look down at something from your own body, it naturally appears smaller compared to seeing it from the side or from another person's perspective. Second, pornography. Actors in adult films are not average. They are selected specifically for extreme anatomy. It's similar to watching professional basketball players and thinking that everyone is supposed to be 2 meters tall. That's not reality. Third, social comparison. Men rarely see other men's anatomy in realistic contexts. And when they do, it's often in environments like locker rooms where posture, temperature, and other factors affect appearance. So the comparison is rarely accurate. Are there differences between countries? This is another very interesting topic. Some studies have attempted to compare penis size across different populations. However, it is important to understand that data quality varies greatly. Some studies rely on self-reported measurements, which are not reliable. Men tend to exaggerate. But when we analyze the most reliable clinical measurements, we see that the differences between countries are much smaller than people think. Yes, there are small variations between populations, but the global average remains surprisingly consistent. Most men worldwide fall between 12 and 14 centimeters in erection, so the idea that certain countries universally have dramatically larger sizes is largely a myth. Does height predict penis size? This is another very common question. Many people assume that taller men have larger penises, but scientifically, the correlation is very weak. There is a slight relationship between overall body size and genital size, but it is not strong enough to make predictions. A very tall man may have an average penis. A shorter man may have a larger one. There is simply too much natural variation. What about hand size or shoe size? Another popular myth. You may have heard people say things like, you can tell a man's size by his shoe size. But scientifically, this has been tested many times. And the conclusion is always the same. There is no reliable correlation. Hand size, finger length, and shoe size are not accurate predictors of penis size. Some studies suggested a slight correlation with the ratio between index finger and ring finger, which is related to prenatal hormone exposure. But even that relationship is extremely weak and not clinically useful. What actually determines penis size? Penis size is mainly determined by genetics and hormonal development during puberty. During puberty, testosterone stimulates growth of the genital tissues. If hormonal levels are normal, the penis typically develops within the normal range. However, certain rare medical conditions can affect this development. For example, hormonal deficiencies during puberty, certain genetic conditions, or developmental disorders, but these cases are uncommon. For the vast majority of men, penis size simply reflects natural biological variation, just like height, eye color, or hand size. When is penis size considered medically small? There is actually a medical definition for an abnormally small penis. It is called micropenis. This condition is defined as an erect length significantly below the normal range, typically less than 7 centimeters in adults. Micropenis is extremely rare. It affects less than 0.6% of the population. Most men who believe they have a micropenis actually fall within the normal range. Do women care about penis size? This is another question that comes up constantly, and the scientific data is quite interesting. Several studies analyzing female sexual satisfaction show that factors like emotional connection, communication, and sexual technique are far more important than penis size. In fact, many women report that excessively large penis sizes can sometimes cause discomfort. So the idea that bigger is always better is not supported by research. When do men consider penis enlargement surgery? In my clinical practice, men seek penis enlargement surgery for many different reasons. Some want to improve confidence. Others want to correct anatomical issues. And some simply want to enhance their body, similar to cosmetic surgery in other parts of the body. It is important to understand that penis enlargement surgery is not only for men with small sizes. Many patients already fall within the normal range, but they want improvement, just like someone might want rhinoplasty even if their nose is normal. The key is to evaluate each case individually. Final thoughts. So what should you take away from all of this? First, the average penis size is much closer to normal than most men think. Second, many of the common myths about predicting penis size are simply not true. And third, confidence and sexual satisfaction depend on many factors beyond anatomy. Understanding your body with accurate medical information is the first step toward confidence and healthy sexual relationships. If you found this video helpful, consider subscribing to the channel. Here we talk about male sexual health, erections, penis size, enlargement techniques, and the science behind male anatomy. And if you have questions or topics you would like me to discuss in future videos, leave them in the comments. Thank you for watching, and I will see you in the next video.